All right, I guess we're live. Is it showing that we're live?
It is, yes.
Okay. All right, so welcome to our J-Pouch chat. I guess first we need to do a disclaimer. And so sorry, y'all, I'm hearing myself. Okay, so we need a disclaimer. We're obviously not medical professionals. Shelly, who will be joining us soon, is closer to being a medical professional. She is studying to be a doctor, so just take everything that we say with a grain of salt, and remember we're speaking for our own experiences. I guess we can go ahead and get into the slideshow presentation where we're going to explain exactly what a J-pouch is. So bear with me here. I'm about to share my screen. Okay. So first, we're going to go over what is a J-pouch. There are two different types of J-pouches. There's the colonic J-pouch and the ileal J-pouch. And for today's purposes, since all of us are have ileal J-pouches, that's what we'll be discussing. The ileal J-pouch is basically made from the ileum or the small intestine. You get a J-pouch either because of ulcerative colitis, familial adenomatous polypsis, and usually they don't do J-pouches for Crohn's patients. How is a J-pouch created? It can be created in 1, 2, or 3 stages. I won't go into the details of what each stage entails, but most of us have the colon and the rectum removed. Some people still have their rectums, but most people have the colon and rectum removed, and you basically just make, the doctor makes 2 cuts, and there you go. Let's see. So after the colon is removed, he kind of curves the end of the small intestine up, and then inserts this little stapling and cutting device, and staples that part together right there. Then at the end of the ileum, he staples the end of that shut. Obviously, he makes a hole at the bottom of the J-pouch to make sure he can attach it to something, which we'll get into in a minute. Now, actually. So then he inserts this tool that actually goes through your butt, and there's this little anvil that he kind of attaches to the bottom of that tool there, and that's when it sews it up, and then it's attached to your bottom, and then he tests to see if there's any leaks by kind of pinching off the end up there at the top, you see, and then inflating it with air, so that's what that is. And this is what a J-pouch looks like. That's the inside. Despite what it looks like on the outside, it's actually hollow in the middle so that it can hold your stools properly. And also, I actually saw this on my own scope. This is what they call the owl's eye, and that's when they do the scope, and to check everything out. They like that nice owl's eye look because that indicates a healthy J-pouch. And if you can see where the fold is, Dr. Higgins actually told me that oftentimes there's what did he call it? Some ulcers, kind of an ulcer line, which is there in most every J-pouch, and he says it's probably due to lack of blood flow in that area. So here's some J-pouch stats. 95% of patients have no complications, so that's really encouraging for a lot of people who are kind of freaking out about it. About 0.25% will have their diagnosis changed from UC to Crohn's disease. So that's a very, very small percentage. It does happen, but it's very, very small. Typically, from what I've researched, and anybody can, tell me otherwise, but 3 to 5 BMs per day is your average. The J pouch, from what I've read, holds about 2 cups of stool. It's about 4 inches long and 2 inches wide. So that's what a J pouch is. And we'll go back to, sorry, get this screen sharing. Did everybody see the presentation?
It's beautiful.
Okay, I'm just making sure everybody saw it, because I was like, it said present it to everybody, so I'm just making sure everybody saw it.
Yes.
Okay, so Shelly has now joined us, so that's great. But we'll start, I guess, introduction. So let's start with Amber. I guess tell us who you are and how long you've had your J pouch and websites or anything else you want to add.
Sure. My name is Amber Tresca. Can you hear me?
Yes.
Okay, good, because it didn't come up on my screen. My name is Amber Tresca. I had my J pouch surgery done in 1999 by my local surgeon who trained at the Cleveland Clinic. He did a great job. I've had almost no complications with it. And I was first diagnosed with ulcerative colitis in 1989. I was 16 years old. So my J pouch is 17 years old, a little bit over 17 years old now. I write about IBD for verywell.com, and I have my personal blog where you can read more about my story at aboutibd.com.
Awesome. Okay, so let's see. Sean, do you want to go next?
Sure. So I'm Sean. I actually had my J pouch surgery in 3 different steps. So I started it at the end of 2014, and I had my ostomy reversed mid-2015. And I blog on morespoons.com about chronic illnesses and lifestyle. So that's my story.
Awesome. Shelly?
Hi, I'm Shelly. I tweet at ulcerative colitis probs. I was diagnosed with UC in 2014. I got my J pouch surgery later that year. It was supposed to be a 2-step surgery. I had steps 1 and 2 like 8 weeks apart, and then mine perforated, and I had a couple more surgeries. But so I ended up having 4 total surgeries, and they were all finished by March of 2015. I've subsequently been diagnosed with Crohn's disease, so I'm part of that 0.25%. But I've been through the whole entire ringer with pouchitis and seeing every single specialist that exists and blah, blah, blah. And in real life, I am a medical student finishing medical school. I'm on year 4 of 4, so my goal is to be a pediatric GI.
Awesome. And Will?
Hi, I'm Will. I was diagnosed with ulcerative colitis in 2009. In 2014, I was diagnosed with colon cancer. 3-step surgery, like Sean, started August, then October, and then December of 2014. So my J pouch is almost 2, or he's 2. Maybe it's a she, whatever it is. It is 2 years old and 2 years cancer free. So blog on woundstowisdom.com very periodically. It was my go-to every day during the process. So if you're ever looking for, today was from surgery 1 to surgery 3, you can kind of find that. But now I'm just like, 6 months later, I'll update something. So don't go there for up-to-date news on what I'm doing.
Awesome. Okay, so I guess I'm Amber Elder, and I was diagnosed with ulcerative colitis in 2011, and roller coaster ride like most everybody else. And in 2014, I had my colon removed and the J pouch created. I had the 2-step surgery, and in July of 2014, I had the takedown surgery. So I've been living with my J pouch for 2 years, a little over 2 years now, and my website is colitisninja.com. So that's that. Now, I guess we'll go to the questions portion. First question comes from Cliff. And so Shelly, he says, I'm 5 weeks in, so I know it's really early, but what are my chances I will never flare up again with UC now that I have a J pouch instead of a large intestine?
So if your surgery goes great, if you have a mucosectomy with your J pouch surgery, which is when they take the mucosa of your rectum out, which is standard procedure now, then you will have no more colon tissue. So you should never have a UC flare ever again. It's not going to be UC anymore.
Okay. Anybody want to add anything? Okay. The next question comes from Heather. She says, what are the most common complications with J pouch surgeries? So who wants to start this one off?
I can, or Shelly can. So when I had my first surgery, I was on a ton of prednisone. So the reason I had to have a 3-step surgery was to get my body off of prednisone safely. So after surgery 1, I had a 6-week taper from going from 60 milligrams a day of prednisone down. During that process, they found a blood clot in my portal vein, which is part of, it's not a complication, but it's kind of, it can happen to people on drugs for ulcerative colitis. So they found that, so I was also on, which then caused further complications with surgery. It's not death-defying, annoying complications. So after surgery number 2, I developed a infection under my incision, under my C-section incision, because of the blood thinner. So I had to pack that wound at home for 6 weeks. So they left it open. So it was awesome. But then finally at the end, all is well. But those were just kind of annoying complications. Nothing like I said, death-defying or, something that I would say was like a huge, oh my God moment.
Right. If I can add, I had the wound infection underneath my incision also because of prednisone, and we didn't catch it until it was this big. So yeah, I had to pack it, for several weeks too. And my only other complication, and it really wasn't that big of a deal, was what my ostomy nurse affectionately called butt fungus, which was basically a yeast infection in my J pouch. And that was not fun. I had to go on 3 rounds of antifungals to get rid of that, but I'm good now. So those are my complications.
I don't know if I really count anymore, but when I still had my ulcerative colitis diagnosis, we called it pouchitis. And I struggled with that for 1.5 years and had to be on Cipro and Flagyl for an entire year and a half, pretty much consecutively. So that sucked. But now I have Crohn's, so I guess that's the other complication that you can get, and strictures.
Sean or Amber, y'all want to talk about any of your complications?
Sure. So for the first surgery, my first surgery was actually pretty smooth. Just like Will, I was on prednisone at the time, so we were still kind of tampering off of that. But other than that, I really didn't have any issues. The second surgery was, of course, the hardest. And then after the second surgery, my bowels, with the anesthesia, my bowels didn't really wake up as fast as they should have, I guess. That's how my surgeon explained it. So basically, my bowels were just not running for a while. So no food, no really anything. They wanted to do the tube like a lot of people have had. Of course, I said no to that. But so then just blood loss and dehydration. Of course, after the second surgery, they were putting together the J pouch, or they did. So I didn't know that blood loss was a thing or would be an issue, but so I lost a lot of blood, and then the dehydration was just always going to the bathroom, I guess.
Yeah, I have issues with dehydration all the time too.
Still to this day.
Oh yeah, I've been in the hospital twice with dehydration. So
Oh my gosh.
always important to drink
Yes.
all the water.
Yes, all of it. Look, do you want to see my jug? I try to finish one of these a day.
Yeah, 5 liters. 5 liters a day.
Nice. I have an app to remind me to drink.
That's a great app
Pops up all
too.
the time.
And then I looked up some just complications that are written down by surgeons. This is from the Kansas City Surgeon Group. So these are the complications that they see most often. Keep in mind, this is only 5% of people. So often is still a very small number. So those can be fecal incontinence. That's when you have accidents. I think all of us have had accidents, but they usually become less common as your J pouch gets older. But some people will have them forever. Pouchitis is an issue, like we talked about. You can get hypermobility, which means your bowels just push things through a lot faster than normal. Usually that goes away after a while, but it can happen. You can get infections, you can get fistulas, you can get small bowel obstructions. 10% of anyone who has any abdominal surgery, like not just us, anybody, will have a small bowel obstruction. So those are super common in general. Then there's Crohn's, stricture, difficulty conceiving, which y'all can talk about, or urinary or sexual dysfunction. Anytime you're like up in that area, anything can happen. Usually it doesn't, but they're all very close to each other.
Yeah.
Right. And the procedures have gotten so much better now, too, that I think you also have to consider that the types and the number of complications that happened years ago, it's getting lower and lower and lower as they're learning more and improving on the surgical techniques. And the other thing is that now we have a much better way to diagnose between ulcerative colitis and Crohn's disease. So this thing where you think it's UC and then whoopsie, turns out it was actually Crohn's disease all along, happens a lot less now because they're a lot more sure that it is ulcerative colitis. So that's something too, if you're reading anything, or especially if you're reading medical research, that you have to take that into account, that things now are vastly improved than, say, for instance, when I had my surgery, and there were a lot of things that they just kind of told me like, we just don't even know what could happen. I actually do have some rectum left. My surgeon did remove the mucosal layer because I think he was just really a great surgeon. And at that time, they didn't always do that, but he did. He did leave me some rectum, what they call a rectal stump, but it has all been fine. It's been good. I really can't complications other than my incision ended up being quite wide because the scar that I have is quite wide due to the fact, just like the rest of you all, that could not get off the prednisone before my surgery. So, but I have to tell you, 7 years after surgery, that scar really doesn't look like much at all.
Right.
And now, 17 years later, if I had, for instance, a revision maybe on the scar, or if I had a much nicer scar because of if I hadn't been on the prednisone, you'd probably have to look really hard to see it. So anyone who's really concerned about the scarring, that's just something I wanted to point out.
Yeah, and one more word on scarring. I did some physical therapy up in the Cleveland Clinic, and my physical therapist recommended that you and this is only for you fully healed people.
Yeah.
You can grab your scar and massage and pull on it to break up some of that adhesive tissue. I know I had a lot of issues with my ostomy site puckering a bunch. And the more that you pull on it, the more it'll go away. And I know I've shared with Colitis Ninja, Amber Elder, my pictures from very beginning to very end. And I went from having 2 belly buttons to normal abdomen. So
That's awesome.
it's not so bad.
And I'll be that egotistical guy to tell you that I've had my scars revised.
That's awesome.
Because I didn't
That's
want to see them.
great.
So
I love it.
I went as far as getting a consult. I did get a consult because my stoma site is quite puckered as well. So also, it's my abdomen is asymmetrical, and I went for a consult too, just because. But then by the time I had my kids and I was in my mid-30s, I said, the bikini days are over anyway. So let's just move on.
Well, during my second surgery, my surgeon actually removed the horrible scar that was left by the abscess wound. He didn't have to do that, but he did.
Wow.
That's awesome.
So, I still have that scar, but, it's not as bad as it would have been, because it was oh my gosh, it was terrible.
Yeah.
But let's see. Okay, so let's go to the next question. Brian asks, I had the J-pouch surgery over 20 years ago. I've noticed over the past year or so I cannot lay on my left side without a lot of cramping, gas, and urge to go to the bathroom. Any ideas why? No issues on my right side, thanks. So, Shelly, do you want to take this one?
Okay, and disclaimer, I'm not your doctor. My word is not don't put any weight on this. Free advice is worth as much as you paid for it. So, my guess would be that over time, people gain weight, and that can affect the blood supply to your J-pouch. And possibly when you're laying on that right side, you could be kinking off essential vessels to that J-pouch. And so when you're laying on that right side, it starts to cramp up because it's not getting enough blood. My recommendation would be, if it hurts, don't do it. But if it's something that you can't live with, go talk to your doctor.
Awesome. Okay, next question is from Pearl. I was wondering, is it okay to deliver a baby vaginally with a J-pouch? Amber?
It is absolutely okay. And I'll tell you anecdotally, I have had 2 children myself, both vaginally, both with labors that I started at home and went to the hospital and labored normally and had the babies naturally. And there's no change in my J-pouch at all. And, I did, when you have a baby, you tear. They sewed it up. I went about my business. Everything is the same as it was before. So that was me. Now, because I'm very concerned about this issue, and I get this question a lot from patients, I've actually talked to pretty much every specialist that I get access to. I ask them this same question, and they've all unequivocally told me that there's no reason that J-pouchers cannot have babies vaginally, that a J-pouch is not a reason to have a C-section, that there are very valid reasons for C-sections, but a J-pouch is actually not one of them. The only time that would change would be if there's something going on in that area with your rectum, or if you have abscesses or something going on, that maybe they might want to consider a C-section at that point. But other than that, there's no reason. You can push a baby out and it'll be fine. So yeah, the other thing that actually nobody asked this question. I was almost a little disappointed that nobody asked about fertility. So I wonder if we could just take a minute to talk about that, actually.
Yes, we can. And in fact, you know, my doctor was actually told me before he did surgery that my fertility may go down. But guess what? I'm 4 weeks pregnant. So, Amber.
So yeah, it's true. If you have J-pouch surgery, the research has shown that fertility can be reduced. But just because you've had J-pouch surgery doesn't mean that your fertility is reduced. So yeah, and the reason why that it would typically happen is because of those adhesions again, and that they would block your fallopian tubes, and that would mean that your egg can't travel through the tube and get down to your uterus where it can be implanted. And in some cases, I've talked to people that both tubes are definitely totally blocked. In some cases, it might be just one is blocked or one is partially blocked or something like that. So it's not that you can't get pregnant. It's that your egg can't get to the right place to get you pregnant. And in that case, you would need to see a fertility specialist. And another thing I see a lot of times is women asking, I've been trying, when should I see a fertility specialist? And for healthy people, they will tell you to wait a year. And I would say 6 months if it doesn't happen. See if you can see somebody and find out what's going on. And even like on that score, if you've had J-pouch surgery and you're ready to start a family, I would just talk to your OB like almost right away. I mean, they should know that you're trying to get pregnant anyway, so that everybody is on the plan and you've got a plan. But I would say that they could even start looking and helping you at that point to make sure that everything is okay. You shouldn't be going 1-2 years with nothing happening and not knowing why.
Right.
So it's definitely, fertility is definitely a big issue, but there's totally help, and you can absolutely still get pregnant, and there's no reason why a J-pouch should prevent you from getting pregnant and carrying a healthy baby to term and having vaginal birth.
Awesome.
You're here.
Good news. Okay, so the next question is from Kimberly. She says, my husband is considering surgery. We are pretty much on the last medications he can be on. He has a form of colitis where he has gangrene. How do you say that? Gangrenosa? Yeah, form on his legs if he flares too far. Have you had any other symptoms from colitis show even after the surgery? So not sure who was on schedule to take that question.
I got it.
Okay.
The short answer is yes, it should go away. The why is because, so you have an autoimmune disease, which means you have antibodies that are directed against a specific part of your body. Autoantibodies, and ours with the ulcerative colitis are directed against the large intestine. So when you remove the large intestine, your body isn't making all of those autoantibodies anymore. And it's the autoantibodies being at such high amounts that start messing with other things in our body. They trip up joints, they get into our skin, they do the pyoderma gangrenosum, they might make erythema nodosum, uveitis, all of the extra intestinal things. So removing the large intestine should make all of those go away. Should, hopefully. There's no guarantees, but should.
Awesome. Okay. The next question is from Steph Horgan. I hope that's how you say the name. Has anyone else been diverted with an elio and had dormant and inflamed J-pouch because they found out it was later Crohn's? If so, how did you know when it needed to be removed? How long did yours last before you needed a permanent ostomy and the J-pouch removed? So, Shelley, you have some insight into that, and so go ahead.
Yeah, I had a diverted J-pouch for a while, actually, because of my perforation. But at that time, they didn't realize that it was Crohn's disease. It wasn't ulcerative colitis. because you have a J pouch that's already made, you have the benefit of choosing whether or not you want to keep your J pouch and use it as a rectum, or if you rather take all of that tissue out and just use your ileostomy. It's up to you at this point. If that tissue is so inflamed and is causing you so much problems, and the medications that you're on aren't working, then maybe you might consider taking it out. But if something you're on starts working and it starts feeling better, you know, you can re-anastomose everything. What stinks about this is these choices are really, really, really up to you. The choice between J pouch or ileostomy is a personal choice, and they're both great, and we choose them for different reasons. So you're gonna have to soul search there.
Awesome. Okay, the next question is, I believe, by Anonymous. I find gas a real problem with the J pouch, particularly after eating. What can help eliminate or reduce this problem? Amber?
So, yeah, gas, everybody has gas. I think, it's just, and actually gas is a good thing. It means things are working right. So you should want to have gas. It means bacteria is digesting your food and producing gas.
I actually miss passing gas normally, but go ahead.
Well, I will say that I can pass gas normally. It's not a problem. I don't recall. I don't recall exactly when that happened. I don't think there was like a day that it was like, yay. So, but yeah, it's usually not an issue. I mean, it can be uncomfortable, and I'm not going to say that I think that's pretty much just a fact of life with the J pouch. Sometimes I struggle with how much do I just put up with, and I think and I don't really worry about it versus how much other people might be bothered by the same thing. Like, I don't know. So, but I will say too that it's going to be a lot dependent on diet. So if you're drinking a lot of Pepsi or you're eating a lot of cauliflower, things like that, you're probably going to have more gas. And unfortunately, it might be a little bit like the ulcerative colitis that you sort of have to figure out what causes you gas and what doesn't. I mean, people can get gas from potatoes, wheat, you really just need to like look up, okay, what are some gassy foods? I know I've written about that. There's 5 billion things on the internet about it, and perhaps cut some of those things out. Now, some of them are really healthy foods. So, if you like them and they're good for you, it's, that's kind of a drag. But at the same time, there's definitely certain things that I think everyone's going to have gas from them with a J pouch. And as time goes on and you pay attention to your pouch and you pay attention to the muscles in that area, you can hopefully learn how to tell the difference between stool and gas. And also, as time goes on, I've been told that your body, in the absence of a colon, your small intestine starts acting more like a colon. So in time, what's happening right now might be changed in a year and might get better. And if your stool firms up, you might have a better chance of just passing gas versus, not knowing what's happening and always having to go to the toilet. One of the things that I'll do is I'll lay like on my left side. Like, that's really helpful. Lay on your left side, or go into like child's pose, things like that, the yoga pose, child's pose. That can help you sort of get rid of some of that gas sometimes.
Awesome. Great advice. Okay, so the next question is from John. He says, how often, if at all, should a pouchie be scoped after surgery? And he says he appreciates it varies dependent on surgery reason. So I guess we just need to discuss our experiences with being scoped. Who wants to start?
I'll go first.
Okay.
I think a lot of this is probably surgeon dependent. Usually your surgeon will tell you, I want to see you in a year. I want to see you in 6 months. I've been scoped a billion times recently because I've had a lot of issues, but my surgeon wanted to see me yearly.
Okay. Anybody else?
Yeah, my GI doc wants me in every 6 months, but that's both for like pouch health and for cancer screening.
Mm-hmm.
For me, my GI actually does the scopes, so he suggested once a year, and then I also see the surgeon once a year, but that's more of like a talk. And then, of course, if you have any issues that arise, like myself, then you're going to go a little bit more often.
Right. Amber?
Yeah, I think at this point we're at yearly. And like you were saying, I think it's highly dependent on the reason why you had this surgery. And when I first had my surgery, they told me they wanted to do it yearly because they weren't sure of the risk of cancer
Right.
at that point. And now they know it's really, really, it's low.
Mm-hmm.
But I think that in most practices, they probably still want to scope you on a regular basis. I've talked to people that it's like every 2 years. You know, I think I'm now kind of at an every year. Like, I don't think I'd want it any more than that. Like that, even that seems kind of like a lot. And I mean, I'm there all the time at my doctor's. So
yeah. Right. For me, I've only been scoped once, and that was right before surgery, and I'm told that it needs to be done regularly, at least. So my surgeon never called me. He said he was going to call me because I asked if I should set up an appointment. We'll call you, he said. So,
well, you might want to call him now.
Probably.
Maybe. And then he'll probably say, well, after you deliver, make an appointment.
Yeah, probably. Okay. The next question is also from John. He says, how regularly should bloods be checked after surgery? I don't remember who was supposed to take that question, but does anybody want to talk about that?
Dependent on what's going on with you. As long as you're healthy, you should be seeing your GP, PCP, whatever acronym you want to call it, primary health care person, who probably isn't your GI. You might have one. Your OBGYN might function as it. Everyone should really have like a family doctor or internist or something. And they should be doing yearly blood work on you if that's something you need. But there's nothing that needs to be checked in your pouch. So, as long as your pouch is healthy, you don't have to get blood work for your pouch.
Awesome. Okay. John also asks, what is the difference between pouchitis and cuffitis? Shelley?
Yes. So cuffitis is inflammation of leftover rectal or colonic type tissue that's inflamed in the same way that your ulcerative colitis was. And so you have cuffitis because you have some tissue that's reacting in that same autoimmune type of way. Versus pouchitis, which can be a few different things. You can have mechanical pouchitis, which is like similar to a washback ileitis. It can be caused from like holding your stool for too long. It can be caused by improper emptying. You could also have an infection, which is a very common cause of pouchitis, and that's really simply treated with ciproflagyl, one or both. And then you can also have like a Crohn's-like pouchitis, which isn't quite Crohn's, and that's treated the same way that you would treat Crohn's. So they're different.
Awesome. The next question is also from John. Do pouches have a shelf life, i.e. do they start to fail after a given length of time? Amber?
So I actually looked this up again today. And no, there's no shelf life. So some of the longest follow-ups are longer than 20 years. And there's really no reason. It's natural tissue. It's going to do what it was meant to do. That being said, I think you should take care of it and take care of yourself and get your scopes and your cancer screenings and anything else that you need to have done. And something that I wasn't aware was an issue is also your weight. that it's especially as you age, it just seems to come from nowhere. But we really do need to stay on top of that. And it's difficult with the J pouch. You're not the same as other people. You don't necessarily have the same energy level, and you can't eat, an orange for breakfast and a salad for lunch and then another salad for dinner. That's really just not going to happen. So it's really important to stay on top of your weight and as much as you can, and just do the best job that you can to take care of yourself. Maybe give yourself a little more care and attention, perhaps, than other people your age might do.
Awesome. Okay, this is also from John, but I'm not sure if it's the same John. So he says, why do we tend to be more susceptible to blockages post-surgery than we were before? So Amber?
Adhesions. All that internal scarring that doesn't do us so well. And that's why they try really hard to do everything that they can to minimize that when they're doing surgeries. And some people are just more susceptible to them than others are. And I don't think that they really have any way to tell you how that's going to go. But I will say that what you can do is chew your food really, really well, drink a lot of water, and ask your surgeon, are there any foods that they recommend that you don't eat after you're fully healed? While you're healing, they will definitely put you on a special diet and tell you what to eat and what not to eat. But then after a certain point, you should be able to go to a more regular diet, but there may be certain things that maybe you might need to avoid. And so that should be definitely an ongoing conversation with your gastro and with your surgeon. And back to that water again, water.
Nope. I've also heard that blockages are very treatable too. So if you get a blockage, you're fine. You'll be fine. In general, they pass by themselves, right? Yeah. By themselves.
5% resolve spontaneously.
Right.
There you go. All right. The next question is from Rob. He asks, generally, how was the recovery from the surgery? I hear that after the first stage, there is a need for frequent trips to the bathroom. Are these urgent or immediate, like when I had my UC flare that led to my ileostomy, or more a situation that you just have to go frequently but not urgent with accidents? So how about Will? You want to start?
Yeah, of course. So I'm just going to read the question again. Yeah, definitely after surgery, you will have to go to the restroom. Your body's like learning it's learning what its new normal is when you're going to the restroom. So I would say, my first few weeks I was going like all the time because it was this new sensation that I hadn't had for a very long time. It's like learning how to go to the bathroom again. I've only potty trained a dog. I haven't potty trained a baby, but I can assume it's kind of in the same vein. You just have to learn what the sensation is. Do I need to go, or is this just my body processing food? So it was the greatest thing. It's like, oh, I feel like I need to go to the restroom. I'm going to go to the restroom and use the restroom. And it's not urgent. It's not stressful. There's not an accident involved. It's just like, oh, I need to go. Mm-hmm. The frequency gone down. So now I go to the restroom 3, maybe 4 times a day, depending on like how much I've eaten, what I've eaten. But it's also like, oh, I can go to the bathroom now because it's convenient, or I can go to the bathroom in an hour when I know I'm going to be home and not in traffic or not at work, and like be in the peace and quiet of my house. Right. So you have the control of when you need to go. It may be more often, but you can control it for a lot longer. Right. That'd be my answer.
Yeah. Bathroom trips after diagnosed will never ever be the same. But when I had my colon, I went way more than I go now. It's drastically been reduced. The urgency, like Will said, is not as bad. The first month or 2 after my takedown, I did have a few nighttime accidents, but for me, it went away. I just wore an adult diaper at night. At first, when it first started happening, I had to, wake my husband up and say, I need to change the sheets real quick. But So after that, I started wearing adult diapers, but it's, it started getting less and less frequent, and eventually it stopped. It may happen again, I don't know, but, it does get better with time. So, let's see. The next question is from Becky. I have the option to have a J pouch. I'm happy with my bag, and I know that pouchitis is almost as bad as colitis. Is it even worth considering? Before I got my bag, I said I would never have a J pouch. Sean?
So for this one, I actually 100% understand where she's coming from, because I loved having the bag. It actually came to the point where, like, I was talking to my surgeon one day, and I was like, it's just such a relief. And he was like, you want to keep it? So I declined. I would say that people on the internet, it does scare you about pouchitis. But for me and for like a lot of people that I've talked to, it's actually very gradual. So when I first got pouchitis, it wasn't like I would just immediately went to the hospital and stayed like how it was when I had UC. So I would say that I would definitely still consider the option of getting a J pouch, because you may not even get pouchitis. A lot of people I know, you do get it at some point, but at the same time, like Shelly said, it's treated with like Flagyl and different medications, and it actually goes away pretty fast. Like, I think I was on my prescription for maybe a week or two. And it's not, I wouldn't even compare it to UC, honestly. It's bad, but it's not ulcerative colitis.
Awesome.
Yeah, it's kind of like, and this is going to be sort of an out there analogy, but if like you were a mermaid and you had gills and you had the choice to get legs, but you were like, well, I hear they break sometimes. I don't know if I want There's always going to be complications. But
yeah, and just because you have a pouch does not mean that you're going to get pouchitis.
Yeah.
And if that's a real big concern, also talk to your doctors. There may be some things that they recommend that you can do to start to try to prevent that right from the start.
Yeah, actually, there's a question that just came through with the comments from Veganostomy. He says, anyone taking probiotics to prevent pouchitis? And he says he hears that it helps quite a bit. And actually, from the research I've done, supposedly that is very helpful. So if anybody has any more insight into that, please add.
Yeah, I take probiotics every day as part of my...
Which do you take?
Primal...
I've heard of that.
It's like Primal 5000 or Primal something. It's from... God, I don't have the bottle in front of me. It's green, and it's like a white bottle with a green label.
We believe you.
Like normal stuff from the pharmacy?
I get it at GNC, and
Okay.
it's like in a locked cabinet, and it's like a situation. But there's also ones that my dietitian said I could get where they come in like a pouch, and you mix it with water, so it activates the bacteria. It doesn't taste very well, and I prefer a pill.
I was in that one. VSL number 3. It comes in pouches, it comes in pills.
They're expensive.
I hated it. And I had so many issues with gas, and like you have to take into consideration my diagnosis was wrong and I had Crohn's the entire time and thought it was pouchitis. And so maybe I'd have a different experience now. But I couldn't do it because of the gas.
Yeah. I'm gassy, so it's...
I used to take. I need to start taking it again. But I used to do kefir, and my J pouch seemed to do better when I was drinking the kefir, and I love this stuff. Like, it's good, especially in smoothies.
Yeah.
So okay, let's move to the next question. Mindy asks, I've only been connected for a month. When can I expect to go only once or twice a night? Right now, I'm going hourly and I'm exhausted. Shelly?
Well, I'm sure we've all had different like hospital courses and recovery courses. What I found really helpful and what was really helpful about being a part of the IBD community was like learning about pouch training. And so when you have your surgery, everything's going to be fresh, everything's going to be new, and you need to give yourself a lot of time to work things out. So like a little baby is going to take 3 years to figure out how to get potty trained. So you need to give yourself more than 1 month. I remember I was like at 2.5 months and I could hold for like an hour and a half, and that was exciting. And when I could do an hour and a half, I shot for 2 hours. And that's just sort of how I went about it. And other things are helpful, like Imodium or Bentyl, to help you relax your inside so that you can get some sleep.
Yeah. And to add on to that, I mean, it's a great question, and it's obviously something that getting a 1 hour and having to get up in the middle of the night and getting another hour of sleep, it's not only not healthy for your body, and it's also super annoying. It's draining mentally. So you, like, your brain just doesn't work during, the day. So what I started doing, and like just a little bit of advice, is just kind of like when you would take 2 tablespoons of peanut butter before I would change my ostomy or change the bag. I think Amber did also. And that's what I still do every night before I go to bed. And I've also changed my eating times so that I eat dinner before 6, because I need 3 or 4 hours to make sure it's all empty. So then I know when I go to bed at 9:30 or 10 that I'm not going to have to get up until the morning. So also, like, if I eat dinner, like I'll get an invite to dinner to go out with friends. It'll be like at 9:30 at night. I'll know that I'm going to get up in the middle of the night once or twice. And that's just a sacrifice I make. But, on a day-to-day normal basis, eating at 6 has helped me sleep through the night. The peanut butter, which is like dessert, so it's great.
Awesome. Yeah, like for me, I rarely wake up in the middle of the night, but there have been moments, and I've probably put this on social media too, where my J pouch will be churning and growling, and Dave will look at me and say, "Amber, do you need to go to the bathroom?" And I'm like, deep sleep. I'm used to it, by now. So I get up and I go, but usually I sleep through the night.
I just wanted to stress like what Shelly said, because my doctor actually used those exact words. He was like, you need to train your pouch. So he kind of explained it to me as, if you feel like you have to go to the bathroom and it's only been 30 minutes, if you run and get up and go, then that's going to be your normal. But if you feel like you have to go to the bathroom and you hold it, then every time I'm not saying like,
right,
no, you have to go, you need to go. But like if it's not urgent, then don't make it urgent, because we're so used to doing that with UC. We don't have to do that anymore.
Right.
So just learn how to hold it, and then gradually over time, like there's been times when like I went once at work and I was so proud of myself.
That's awesome.
I love those days.
Yes.
And it's not. I was also told to hold it, and within reason.
Right.
Like not holding it. But I will say, it's going to be uncomfortable to hold it, and you need to expect that, and literally just live through it a little bit. Because I was also told that you kind of have to let your pouch stretch out a little bit so that it can hold more stool. So yeah, definitely. The pouch training for sure, and it's not a comfortable thing to do, but you have to think of it as the long game.
Right.
Yeah. If you're like squeezing and you feel like you're gonna die, and
right. Yeah. I mean, my surgeon said the exact same thing. Hold it so it'll stretch, and hold it for as long as you can, but go when you need to. Yep. Here's another question that came in through the comments. So I want to address this because I think it might be really important. Someone named Sean asks, had my takedown January, became very anemic for a few months later, not absorbing iron. Is this common with others with a J pouch? Shelly or Amber, can either of you address that?
Your small intestine should be absorbing the iron. But again, how long ago was the surgery?
Let me see. January, it looks like.
January. So it's been this long and still having problems with iron.
Yeah. Well, actually, you know what? Now that I think about it, I have a friend who has a J pouch, and for a while, and maybe even still now, she was going for frequent infusions.
Some
with
people
iron.
do. Some people
Yeah.
do.
Yeah, I
And-
went through for iron infusions also.
Yeah, it can take a long time to turn that around with the iron. I know myself personally, I'm always running low. You know, my blood count's always low. That's just, but I think that's more of just like who I am.
Mhm.
And also I'm unable to take dietary iron. It just doesn't play well with my pouch. And I've tried all different kinds. So, but I know that a lot of people do actually get an iron infusion, and of course they feel like $1 million after.
Oh my god,
Right.
that's the best thing ever.
So, I mean, that's super annoying if that's happening, but it's definitely treatable. And I also wonder, you know, you have to look into why is that happening? So what's the root cause? Is it actually or, you know, something that's going on with the intestines, or is it something just totally completely different? Also, like if you have heavy periods, you know, like I've had my whole life, it's just part of who I am. And so it's always been a struggle. It really doesn't have anything to do with that. So
Yeah, and I also adding to that, when I was having iron issues, my doctor recommended I start cooking in cast iron. So,
Yes.
Yes.
so I bought
Yes.
a cast iron skillet. I bought a cast iron pot, and I literally cook everything in cast iron.
Yeah, that actually really does work.
It does.
Really
And if you do a little bit of reading about foods that contain high amounts of iron, and then also the foods, like if you eat vitamin C with your iron, and then you might be able to absorb it better, and it gets more technical than that. But do a little bit of reading about it and find out also too, if you're eating certain types of food and then you're drinking tea with it, you don't absorb the iron as well. So definitely do some reading, and if you can get a referral to a dietitian who can help you sort of figure that out, that, you know, that will take you really far.
And there's also a chance it's not your pouch. It could be some underlying inflammation. So, you know, talk to your doctor.
All right. So the next question is from another anonymous. About to go for surgery 2 out of 3 for getting a J pouch. Was curious if one was able to tell the difference between gas and stool. We kind of talked about this earlier. And expel the gas without having an accident. Also, is a person's stool thicker with a J pouch versus an ileostomy?
We had so much fun with this when we rehearsed.
Oh, this was awesome.
Oh my God. Can I tackle this one first?
Go.
About poops and farts. I do. It's my favorite thing. I personally, I kind of know when it's gas, and but I am never brave enough to fart. Like, it's not gonna happen. I will go to the bathroom and fart if I need to fart. And this is something my doctor was like, every time you do go to the bathroom, make sure you do fart at the end or at the beginning so that we know that everything's working. I don't know if anyone has, that's something I always look for. So I was like, if I fart, I'm like, we're good. As far as the stool being thicker, I remember in my pouch, it was like applesauce. I don't really know what ends up coming out of me. I would say it's maybe the same. It's definitely not the same. It has gone through a little more, digestion than it has when it goes through the out of your ileostomy. But the consistency, I would say, is about the same. It depends on what you eat. Just like if you ate Taco Bell and your bag blew up into a balloon, that's going to be what's happening to your body. Like that's just diet. I feel like a lot of stuff we're talking about is all diet. So if you want it to be thicker, eat peanut butter. Peanut
butter and apples.
Dude, yeah. I eat a jar of peanut butter a week. Like I'm not joking. But it does help like thicken things up, makes things move a little slower. I still no confidence in passing gas. Not going to happen ever. Not gonna do it.
Yeah, addressing the thickness issue. I have read anyway. I'm sorry, I've got this cat here who's like needy. He jumps up whenever he wants to. The thickness I have read online where it's toothpaste consistency. I honestly rarely get the toothpaste consistency. It's mostly chunks and watery.
Yeah, it's full on
That's just my
diarrhea.
experience.
Pretty much
Yes.
all the time. Yeah.
But, you know, it's not like ulcerative colitis. It's not that bad. It's, you
Not
know.
bloody. It's not bad.
No. And if it is blood, I have experienced some blood, but that's because I've gone a lot and it irritates my bottom. But other than that, no. And it's not the same as type of blood as ulcerative colitis either. It's just on the toilet paper.
Yeah, now that I've been treating my Crohn's, mine is like almost solid. Toothpaste consistency.
That's amazing. I'm jealous of your
Lucky.
toothpaste consistency.
I don't want to compare my poop to toothpaste.
It's so much better than
That's funny.
Sorry.
Okay. So does anybody else want to add anything to this?
We always tell kids soft serve ice cream, so tell
Oh, now that's ruined too.
Yeah, I can do the Bristol stool chart and types of candies. So if anybody's ever wondering.
That's awesome.
Oh my God.
Okay, so Stacy asks, has anyone had a rectovaginal fistula with a J pouch? If so, did you get to keep your J pouch after it was repaired, or did you end up with a permanent ostomy? Shelly, do you want to discuss this?
Yeah, sure. So there's a possible surgical complication that your surgeon might mistake. If you're a woman, they might mistake your vagina for your butthole and put the anastomosis thing into your vagina and accidentally anastomose your like proximal intestine to your vagina. That's usually they know immediately that they've messed something up pretty much when they start testing things out, because it's very clear. So that might be one way that you get it. Y'all as ulcerative colitis havers shouldn't be forming fistulas as it is. We don't tend towards that. Any reasons why it might happen might have been like abscessing or something like that. It's really rare. It didn't even make the list that I got. So unless it's like an acute surgical, I don't want to use the word mistake, but adverse event, then maybe.
Adverse event.
Okay. Let's see. So Ashley asks, what can you do to help the smell? I'm worried that once I get my J pouch, I'll stink up the whole house. I use Nascent, Hollister M9, or peppermint essential oil now, and it totally takes any smell away. So who wants to start this one?
I'll do it again.
Yes, go.
Okay, so Ashley, congrats on your December 9th surgery. We will all be thinking about you. I'm assuming this is the construction, not the takedown. Looking to help us out. I'm worried that once I get my J pouch. So yeah, so probably construction, right? So congrats. Have a wonderful Christmas, because you will not have ulcerative colitis. I used M9 in my bag, and obviously that was awesome. The smell is gonna happen. We're gonna back to diet again. Everyone poops. Poop stinks. I would say go for the courtesy flush. Go for the smell. I have a pack of matches by my toilet and a candle, and that's just like you're not going to stink up your whole house. It's not bad, and it's not going to be any worse than when you had ulcerative colitis and we're going to the bathroom 20 times a day. So that's what I say. Shit stinks, but water's wet.
Yeah, I mean, I don't know if I've gotten used to the smell or if it's just gotten less. And I think Shelley talked about last night the that when you're emptying your ostomy, you kind of think it's right there. Or for me, and obviously for her too, it was right there in your face. So it's like, and now it's behind you. So
Yeah. If you empty your bag facing the toilet, then
which I did.
from your nose to the toilet bowl is much closer than if you're turned around and sitting on it properly, and then your nose is farther away. We were just talking a little bit yesterday about, if you like poopery, get poopery. If you like air fresheners, do that. And the only thing we could boil it down to is poop sticks, and
Right.
we're lucky enough to make it. So
Right, exactly.
Right. Yeah. That's what I'm like, Ashley. Like, just be totally. You're gonna feel so awesome. You're not gonna worry about
Exactly.
the smell
Yeah.
of anything. You're gonna be so happy. It's gonna be so great.
Yeah, and I think too, I thought of this earlier today, in that I have sort of cultivated what I like to call my IBD elevator speech. And that, we all have to live in the world. And, I've been in a public bathroom where somebody's been like, woo, like, what went down in here? And I'm kind of like, well, actually, they found severe dysplasia in my colon, and I was 26 and I had to have it removed. And so my anatomy is different than yours. And I am sorry I offended your olfactory senses, but I'm alive and I'm happy to be. So, I recognize that it can be distressing to people and they're worried about embarrassment and so on and so forth. But I would say, you know what? You're alive, and
Right.
marshal those inner forces that you have. And hey, this is life. This is how it is. So we're just going to move forward with it. And you know what? Somebody wants to talk about it. I'm going to take that minute to educate them a little bit.
Right.
bathrooms are made for pooping, so get over it.
Get over it.
It's true.
In our bathroom, we have a thing that just spits out air freshener all day, and literally this thing was like $6 at the dollar store. So if you're that worried, but not drinks it at all. Like, that's not a big deal.
Awesome. All right. So the next question is from Steven. He asks, what do you see as the next evolution in J pouches as they apply to the management of inflammatory bowel disease? The first thing I want to say about that is the J pouch took years of development. I mean, it began development in like the 30s and 50s. So over time, medical advances are always being made. So obviously the procedure improves. As far as what's next, I don't personally know. But, if anybody else wants to add anything.
I could find nothing about that. There could be somebody who is working on a new surgical advance right now, but I could literally find no mention of, this is something that we're trying now and this type of thing. And of course it was different in the 30s and 50s. They probably did all sorts of things that we wouldn't.
Oh my goodness. They did some crazy stuff.
So yeah. And we've already gone from, they used to do S's and W's, and they still might in some places. And now we figured out that J's work the best for most people, and, things like that. So it's come really, really far. I know that I was like, when they started doing it laparoscopically on a regular basis, I was like, what? There are people that don't have to get opened up all the way? Like, I thought that was amazing, right? So for real. So yeah, who knows what the next thing is, but I couldn't find anything specific about that.
Yeah, I think our hope, I'll speak for everyone, that we don't have to advance J pouches, that we can advance the treatment of the disease.
Yes.
And curing the disease. Obviously, a J pouch is the cure right now to remove the organ, remove the disease, right? Well, I know. I'm putting it a little light.
Take the brain out. Just
take the brain out. You cure brain cancer. I get it. No. But I think our hope is that they find some sort of reason we get ulcerative colitis, a reason we get Crohn's, a reason that we have to go through this great to fix it, right? We don't want to have surgery. That's not,
It's not
no one
ideal.
wakes up and is like, I want to have surgery today. It's like, you know, you just don't want to suffer. So I think that's our bigger goal.
Yeah, and I think if there's, besides that, I mean, that's, you know, our overall ultimate goal, although for myself personally, I'd really like to see some talk about prevention. But I think figuring out pouchitis, you know, that could do a lot for a lot of people with pouches, figuring out exactly why this happens and why we tend to get the pouchitis, but people that get pouches for other reasons don't.
Right.
So what's going on, y'all? And so, I would really love to see some more, a push in that direction. We know that probiotics can help. That's the only thing that's really been studied so far. So, yeah.
Yeah, I know I see, and Amber and I have read a whole bunch of papers by Bo Shen at the Cleveland Clinic. He's like the pouch.
He's the guy.
And he has a lot of theories about blood supply and maintaining blood supply to the pouch. I've, as a future medical professional, haven't yet been in a surgery for a J pouch. I'll be doing that next month. So
Nice.
you about that, but I feel like it must be so difficult to re-finagle blood supply and make sure it's all intact. So I think he might be onto something there.
Awesome. Okay, our last question is from John W. He says, just wondering what pouchitis feels like. Have a pouch for 4 years and always wondering what can go wrong. So Sean, do you want to talk about pouchitis?
Yeah, so like I said, it was very gradual for me. And then a lot of people that I talked to that have had it as well, they said the same exact thing. Like, it started off slow. So I didn't even know I had pouchitis until like one day my boyfriend just looked at me like, are you okay? You've been going to the bathroom in the middle of the night. So then I was like, okay, let me call the doctor. So once we got scoped and everything, that's when he was talking about the pouchitis. And then for a little bit, I was kind of in denial because I never had anything wrong with my J pouch. But like at first, it's not, I don't know why people even compare it to UC. It's nothing like UC. It's just annoying, basically. So like I said, like I was just going in the middle of the night more frequently. It wasn't like it hurt or anything. I didn't even know that anything was wrong until someone pointed it out. And then as it kind of, because it did kind of get a little bit worse before it got better. As it got worse, it just went from night to day. So basically I was going more often in the day, and then I would have stomach aches. But it's still, I would say it's miles away from UC.
And has anybody else here had pouchitis? Because I haven't personally. Besides Shelly, you were just
I don't
kind
think
of
my experience counts anymore.
right. I know. That's what I'm thinking. Anybody else? So see, it's not very common, I guess. You know, it's more annoying, as Sean said. So, you know, not that big of a deal. But so that's our chat, and I had a great time chatting with all of you. Thank you so much for being involved. Does anybody want to add anything before we go?
I do.
Okay.
So, I know online there exists a lot of like ostomies versus pouches, and like which one is better, what, blah, blah, blah. And like, I think it's really important to understand it's all personal choice. It's all up to us, up to us as in up to each of you individually. You got to make a choice that's best for you. That might not be the same choice that's best for everybody, and that's totally okay. You might choose to keep your ostomy. You might go for J pouch. You might do J pouch for a little bit and decide, hey, ostomy was so much better, and go back to ostomy. And it's awesome that we have that option. But I think what's really important is to be excited that we're alive and not be scared about J-pouch surgeries, because 95% of the time it's all fine. So, you know, that's why I'm very reticent to share my experience, because like the math says, it's 0.25%. It's like nobody.
That sounded bad.
Was that
Like
Jack?
the dish is in there.
That was Jack, wasn't it?
Yeah, we just knocked over a cup.
Oh boy. Thanks,
Yeah.
Kat.
Clean that up.
Okay, go.
I would say, in that vein, whenever I see that question, and I understand because I remember laying there in the hospital bed prior to my takedown, thinking to myself, why am I doing this to myself? I'm so good now. I had 10 years of ridiculous, horrible, so sick. I'm great with this bag. I can keep going with this. Why do I want to do this to myself? And of course, the J-pouch was already created, and the takedown surgery is nothing. I was home in a couple of days and back at work in a couple of weeks. So, and that's how it is with no complications. But whenever people ask, should I stay with the bag or should I get a J-pouch? And if you're asking me just my total opinion, why wouldn't you go for a J-pouch? I really have to say it's extremely successful. And the people who have problems, I mean, actually a lot of them will still tell you that they're glad that they have a J-pouch, honestly. And the people that have great J-pouches are not on the internet talking about their great J-pouch. They're
Right.
out getting married and having babies and having a family and going to Disney World and doing all this awesome stuff. And you probably wouldn't even know that they had a pouch. I have friends that they never talk about it. It's not a thing to them. So, you know, it's my opinion that, you know, if you're a candidate for it, I say, why not?
Awesome. Does anybody else have any last words that they want to say before we call it a night?
What I missed? Sorry.
I just want to
So we're wrapping up. So like we finished answering the last question. So if you want to add anything before we say goodbye.
Yeah, Sean, do you want to go ahead? You had something.
Sure. So I was just gonna say to anyone who's like going through the surgeries, we joke and laugh about it now because we've been through it and it's very lighthearted. But of course, we know and you know that it's hard and it's a struggle. But just I would say focus on the end result that you're trying to get to. I know when I was going through the surgeries, I was freaking out. So especially after the second one, I think Amber can attest to that. So I would just say really focus on the end goal because it's difficult, but you'll get there. And then a lot of other things that we're kind of lighthearted about, like pouchitis and everything. Of course, that's difficult and everybody has their own experiences. But at the same time, like just focus on your end goal. Like I said, the goal is just to get better and to be happy and live a semi-normal life. So always keep that in mind, even for the people who are like asking questions about like your poop stinking and things like that. Like really just think about what we're trying to do. Our goal is not to be perfect. We just want to have
Better
a good
life.
Yeah, exactly.
Big picture.
I wish everyone luck.
Yeah. Will, do you have anything to add? Is Will still there? Can y'all hear me?
Yes,
Yeah.
I can hear. Yeah, we can hear you.
Is Will still? Did he get kicked off again?
I can see him, but he's not moving.
Yeah.
Uh-oh. Will. I guess if maybe I'll add some words. Maybe Will come back. Okay, there's a cat trying to kill my leg right now. He's like trying to climb me.
Take us home, Amber.
So, okay, cat, you need to stop. Okay. Okay. If I were to add anything, I would, echo what everybody else has said. I know everybody's experiences are different, and there are a lot of horror stories online, and those are always scary. And I know, like, when I was first diagnosed with UC, my second opinion told me, you're young, you're pretty healthy. I would recommend you get surgery now. And back then, I was like, no, I'm not ready for that. I have options. I'm not married. I don't want these scars on my belly. I know I was vain. Okay, I admit it. But, so back then I was like, I still have options. So I'm going to try my options that I have now and, maybe think about surgery in the future, because right now I'm okay. But, everybody's experiences are different. Everybody's, I guess, you can handle what you can handle. And, if you feel like you're ready for surgery, go for surgery. But if you have options, definitely go for your options. There's a lot of options out there, and there's several medicines going down the pipeline. So, it's not the end of the world if you have to have surgery, but just know that there are options out there. So.
Yeah, we don't have colons and we do great things.
Exactly. And, here I am. I had my surgery and I'm, doing relatively well. I want to be a voice to tell people, not everybody has a bad experience. And, that's something that I think a lot of people need to know.
Oh.
So I guess Will is gone.
Aw.
I'm sorry, Will. I guess we need to go, though, because it's getting late, and I'm sure everybody wants to go to bed because we're all sick people.
Broken glass.
All right. Well, I guess we'll end. Thank you again, everybody. Sorry, Will, that you're gone. I'm sure he would have had some really great insight to tell us, but you can find him on Twitter. So
something really inspirational happened.
Yes. So Will have some great inspiration. Go to his website. I think it's Wounds to Wisdom or something like that.com. So, contact him because he's awesome.
Through handles again.
Okay. Yes. Let's go through handles. Amber?
You want to do Twitter? In most places, I'm at About IBD on Twitter and the Instagrams and the Facebooks, the Book of Face.
Yes. Okay. Sean?
Twitter is just Twitter and Instagram is just at Shawn, SHAWN, then my last name, BETHEA, because no one could spell it, _ that's for both.
Okay. Shelly?
Mine is, it's easiest just to go straight to my Twitter and jump off from there. It's ULC Colitis Problems, ULC Colitis, or ULC Colitis Probs with a Z. I don't know how long it's going to be that, but that's what it is right now.
That's what it is right now. And Will's Twitter is William Lanier, and it's WILLIAMLANIER for anybody who needs it spelled out. And my handles are Colitis Ninja, at Colitis Ninja. So, just if you have any questions or, want to connect with us, please do so. Thank you, everybody, for your time. I love all of you. You're all amazing. And even Will, who, got bumped out or whatever. So
thank you, Amber,
right.
for organizing and for pulling it all together. And this was a really great thing. Like,
hopefully we'll do this again. This would be awesome.
I would really like to do more.
Yes.
We could talk about so many other things, I think. So
yeah.
Let's do more.
Okay, cool.
Yeah.
Cool.
Thanks, Mom.
Okay, well, all right. Good night, everybody.
Good night.
Bye.